Then you got to heal the leaky gut. And oh, by the way, the reason that most people have a consistent leaky gut, even though they've done something in the past and it felt good for a while, it's an overfiring sympathetic nervous system, gut problems plus brain problems.
Yeah.
Plus brain problems. And this is for sure. Even if you've done all the right things for your gut to this point in time and you still have a problem, here's why.
It's your brain. Everybody in the literature now, so it's coming out more and more, where they're discussing the brain and its relationship to the gut. So first, it's like everybody had this epiphany about the gut and how the gut affects everything. Like I mentioned, how it affects autoimmune disease and diabetes and blah, blah, blah. And so they start talking about the gut-brain axis, the gut autoimmune axis, the gut metabolic syndrome axis, how the gut's just affecting everything in the body. Brain. And so everybody's saying, wow, this is amazing. But then they start going back and really looking at all the data, and what's causing the gut to be a problem is actually the brain in the first place for most people. People have been through all these stressful circumstances, and they're now showing that if you've been through stressful circumstances in childhood, the one thing that you're predicted to have is a gastrointestinal problem. Now, there are associations between childhood trauma and anxiety, and childhood trauma and depression, but the strongest correlation is to a gastrointestinal problem.
Childhood traumas are verbal, physical, sexual abuse, divisive divorces, alcoholic parents being abusive. It could be verbally abusive over a long period of time. It can be an abandonment issue. It could be that you could never do anything right.
When we've been through trauma in childhood, the fear center in the brain becomes learned, it becomes stronger, it can actually grow new brain cells. And so now it starts firing off these fear-based responses at a higher level. Even when you're relaxing, it's maybe revving at 4,000 RPMs rather than 2,000 RPMs where it should be. And those signals are going to your gastrointestinal tract. And these signals go throughout our entire body. So it's preparing you to fight the lion, even though you have nothing to be worried about at that moment in time. And then as a result, gastrointestinal juices, as some people refer to them, enzyme production slows down, acid production slows down in the stomach. And so this can precipitate all these microbial factors that are seen with leaky gut and irritable bowel syndrome and SIBO. These can precipitate motility changes, which is the thing you got to get. So motility is affected when your brain is in this state. So you may either get too much motility or too little motility. Both are bad. If you have too little motility, well, guess what? You're going to grow too many bad bacteria, which is SIBO. If they make methane, then you're going to get more constipation. And so you're going to take more drugs for your constipation, and you won't be able to fix the problem because it's coming from your brain. They're now seeing patients who have had traumatic brain injuries, people who are football players, boxers, those who fall off a slide when they're a little kid. They can hit their head, and the first thing they see now is that they get leaky gut syndrome. The first thing. And now they're discussing in the literature that the first line intervention for patients who hit their head and have a concussion is you have to give them a drug that blocks stress hormones so that they don't develop leaky gut syndrome.
You have a part of your brain that has its pedal to the metal and it's putting out stress hormones intermittently 24 hours a day, and you have zero control over it. You're in this fight-flight mechanism. You might get heart palpitations. You might get anxiety for no reason at all. You get a stress response is what you get to a stimulus that you wouldn't have gotten a stress response to had this not been occurring. And you're trying to stop it and you can't stop it. And you go to psychologists and you can't stop it.
When people have this overfiring fear center, which is tied in with IBS, tied in with depression, anxiety, and all these different conditions, people who can't sleep. I mean, we're talking a major percentage of the population here. 30% of the population has anxiety, 16% has depression, 50% suffers with insomnia at some point in time, 20% has IBS. I mean, I can go on. So this is a lot of people out there. So this overfiring fear center then fires down to your adrenal glands, the stress glands, makes cortisol, which feeds back up, and it kills brain cells in your memory area, and mainly your orbitofrontal cortex. These are the two areas that shut off the fear center. So now you're taking Xanax to kind of put out the fire in the fear center, but then these two areas are still weak and they can't shut off the fear center. So that's why this just keeps going and keeps going. Your gut keeps getting the same signals, and you change your diet and you tell us, I'm on the perfect diet, as you scream at us, but you still have leaky gut syndrome. And this is a huge reason as to why. As an American population, we have problems in our guts. We have problems in terms of the gastrointestinal bacteria. It seems like the bacteria of Americans have become deranged. And so this is a lifelong battle.
Let's say for you, you did all of the exact right things. If the cause of your leaky gut Is this overfiring sympathetic nervous system flooding your system with cortisol 24 hours a day off and on? It's coming back. That was a huge breakthrough for us, not just on leaky gut, but this was a huge breakthrough for us on chronic pain. Okay, when we finally were sitting there at breakfast one day, I went, it isn't that folks are stressed. It's that they have post-traumatic stress syndrome. And we even work with a functional psychiatrist who is a gentleman who is phenomenal gentleman who understands that these are functional problems, that his patients are not crazy, they're not weak, they don't need to pull up their bootstraps. And people, for the most part, go, that makes all the sense in the world. Virtually every one of you has a bad gut, is stressed out of your mind. But it's not you being stressed, and it's not that you can't handle stress. Something put the pedal to the metal on your midbrain where this fight-flight syndrome is, and the brake is not working. The idea is to get that thing calmed down.